cough infection that's sweeping across the United States and threatening your dogs and mine. So without further ado, let's get started. This infection started last fall and has spread from the Pacific Northwest, Southern California, across the United States, Florida, New York. No one seems to be spared. So what symptoms are our patients experiencing? What kind of outcomes are they experiencing? How can we prevent it? What's next? The specific things that we're worried about with kennel cough are kennel cough is a highly contagious, infectious disease that's multifactorial. What do I mean by multifactorial? You'll see that here in a second. But the contagiousness is primarily upper respiratory. Dogs in close proximity are the higher and higher risk. Dogs farther apart, lower and lower risk. Dogs in places like boarding kennels and the like are going to be able to spread it much more rapidly. The contagiousness classically is nose to nose or environment to environment. Boarding kennels, doggy daycare, dog parks including water bowls and the like, rescue centers, shelters, sporting events, agility events, dog conformation events. We're supposed to go to a big show at the first weekend in January. Doesn't look like this family and the Magic Burners crew are going to make it because of the potential exposure, and we want to make sure that our puppies stay 100% safe. Grooming parlors also are potential high risk. What symptoms? If your dog starts with a harsh, dry cough out of the blue, generally stimulated by exercise, you get this retching, gagging, a croup, a whooping cough type sound. The classic Bordetella infection is actually a close relative of Bordetella hooperentii, which is the kennel cough infection, which is the whooping cough infection that people get. So you have this loud, whooping, croup type sound. In the early stages, many patients don't lose their appetite, but they could lose their appetite. Many patients will get a fever, but not severe. And initial stages of classic kennel cough is they don't feel that bad. And that's kind of a sleeper because the next step could be bad. So any symptoms like this, get on the phone, get your kid into your veterinarian, and make sure that we don't have any progression to the next stage, which could be not good. Because if the symptoms progress, you can get appetite loss, you can get fever, you can get nasal or ocular discharge, and the patient's gonna feel bad. They're crummy. They don't want to get up. They don't want to bounce around. They don't want to do what they're supposed to do. They feel crummy. They could start with breathing problems, labored breathing problems, abdominal breathing, deep breathing. Their gums could turn pale and or bluish in a poor type color, and you want to make sure that you don't have that going on. Symptoms like that, you should consult your veterinarian immediately. Mitigating factors: poor health, age, vaccination lapses, stress, all can reduce patients' resistance and make them more susceptible to not only this infection, but other things. The majority of patients that have poor outcomes have comorbidities. What do I mean by comorbidities? They got multiple things going on. They're not the young, healthy, vibrant dog that is athletic, normal weight, and bouncing around. They get one illness and they bounce back. They're the overweight, poorly exercised, poorly conditioned, perhaps vaccination lapse. They go to the kennel because of holiday boarding, and lo and behold, they get sick, and they get sick much more and much longer and much more severely than the average patients will. Close proximity in enclosed environments where the humidity goes up are mitigating factors, because the high humidity allows these particles and these droplets to spread. Think of COVID and us when the crisis was happening back in the early 2020. Close meeting, close contact, spreading the disease, not good. Same factors are applying to our kids today. We're seeing 3 varied clinical outcomes, from mild to chronic and unfortunately poor. The outcome number 1, mild, where you get a chronic upper respiratory infection that may last for, well, the average kennel cough is a course of duration 2, maximum 3 weeks. With this illness, we're seeing patients that are 6, 8 weeks, even going out to 3 months where they're still having some type of problem. That's not good. But most of those patients are treated as outpatients, and that's okay. Outcome number 2, it can progress into a severe bronchopneumonia that is minimally or not responsive to antibiotics or traditional therapy. Most of these patients need to be hospitalized. Outcome number 3, poor results. Acute pneumonia, acute bad sick dog, and many of these patients will have a poor outcome in 24 to 36 to 48 hours. Poor outcome is code for these patients croak, and that's not good. What we know for sure is that it's spread across the United States, and all patients in close proximity are at risk, even if they're perfectly vaccinated. Because kennel cough in its, I was going to say prime, by definition, it's a complex of multifactorial diseases. I alluded to that earlier. Multifactorial means that there are at least 33 separate organisms identified in the canine infectious respiratory disease complex that make up what we want to call kennel cough. Bordetella, distemper, influenza, parainfluenza are all protectable by vaccination, but that's a small percentage of those 33. There are viruses, there are bacteria, there's mycoplasma, it's multifactorial. And the patients that have poor outcomes, usually end up with multiple or a hodgepodge or a pick and choose of some bacteria, maybe mycoplasma, maybe a virus, all 3 combined to bad outcome. So we want to prevent as many of those things as we possibly can. We know for sure that emergency centers and insurance companies are reporting as much as a 50% increase in these sick animals. Now that doesn't mean that 50% of the animals out there are sick. It does mean that they're having a big increase over this time period compared to a year time period before. And that year time period before, there was a kind of a baseline type thing, and there's a huge spike in that, which represents what we're all seeing right now. So the statistics are accurate, but they're not extrapolatable. They're not extrapolatable to the general population, but we know we need to take all the precautions that we can, do we not? So we know it's not flu. We know it's not known bacteria. We know it's not known viruses that we can test for. And we know it's not mycoplasma because we can test for that. The majority of these kids that come in and get sick, they get a standard broadjet test. Now in this time, and now in this decade, we have actually DNA, almost a forensic test that can screen for 10, 15 different specific bacteria that are known to be part of this, this complex of diseases. And they're not consistently showing positive for any of those. So we know that we don't have to worry about those illnesses right now, and we can focus on other things. So in my office, we're screening on the phone for all infectious, contagious upper respiratory diseases in patients that are coming in the front door. And those patients are going to get curbside triage, maybe even the virtual care, and applying standard of care. The cases that I've seen right now are all responding and are falling into this chronic group that appear to be responding in a predictable, safe type fashion. Personally, we've canceled dog shows, we've canceled training classes, we're not boarding at the office, and we're practicing social distancing. What do I mean by social distancing? Well, excuse me, the social distancing is condensed into, think of, back to COVID, you and I would stand in line 6 feet apart. Whether that was effective or not, you can argue about that all you want, but it reduces the amount of contact and droplets between people in the right? So social distancing is not you standing here. Social distancing is not you standing 6 feet away from your friend and the dog's nose to nose. Social distancing is the dog 6 feet away and you got a good 6 or 10 feet away together. Don't try measuring that. That's silly. If you're walking down the street and you see another dog, cross the street, go to another, go, and if you go up a driveway and let them go by. There's no good reason to say hi to a strange dog in this environment. Just no good reason to do that. If you want socialization, if you want training, you want this, get with your trainer, get with your friends, and arrange for socialization with known healthy dogs. You don't want to meet strange dogs on the street, nose to nose, because even if they're not coughing, they're going to be licking each other, they're going to be sharing saliva, and that's not what we want. So, prevention. Pay attention to all aspects of canine health, because a healthy dog, the resistance is going to be up, their stress is going to be down, and their ability to fight any infection, let alone this infection, is going to be greatly improved. Make sure all vaccinations are current, and make sure any concerns that you have about health are addressed by you and your veterinarian. And we talked about reducing exposures. Review about core vaccinations, distemper, adenovirus, which used to be hepatitis. We no longer call it hepatitis, we call it adenovirus. Parainfluenza and parvovirus are the core four. I personally think Bordetella should be part of the core four, particularly in my area here, because we see a ton of that year-round, even when kennel cough isn't at this killer stage whatsoever. And because of the increased risk whatsoever, if you're boarding, if you're going to daycare, if you do dog parks, I would strongly recommend that you get boosters for or start canine influenza vaccines. So we've talked about symptoms, we've talked about outcomes, we've talked about prevention. What's next? Are there going to be vaccines? What's going to happen? I don't think we know. I think we have to practice good preventative care. I think we have to practice good social distancing. I think we have to limit boarding and daycare to the extent we can. I realize we all have lifestyles. I realize that some people depend upon daycare to go to their own jobs and feed the family. That can't be changed. But to the extent that you can avoid things, do it. With that, I'll go to questions. I appreciate all your attention. I appreciate your wanting to take time out to review this important information, because it's critical to make your dog healthy, to keep him on a long and happy track, and to make you worry-free.